I've been thinking about it. I just haven't written anything down. Okay, so something that's very important to us with your overall health and your oral health is your support and foundation of your teeth. So this chart here shows the progression of disease from health, gingivitis, early periodontitis, moderate, and advanced. So in the first section here, this first picture, we use a little tool that helps us measure your gum tissue around your teeth that sits right above your bone level. It looks something like this. It's marked off in millimeters. Can you see those there? Okay, so healthy will show us if you have 1 to 3 millimeters as shown in this picture. When we get to gingivitis, it's still about 1 to 3 millimeters, but we now have bleeding. Bleeding is one of the #1 indicators of active infection in your gum tissue. So once we start getting into 4 millimeter pockets, which you can see here, is where we start seeing early periodontitis. Once we get from 4 to 6 millimeters, which you'll see here in this section, is moderate periodontitis, and advanced is 6 millimeters or deeper. So like I showed you before, we'll be measuring around your tooth just like that. The second row of pictures here shows the firmness of your tissues for being healthy. Gingivitis starts showing some inflammation of your gums, but still 1 to 3 millimeters. Then we start into the periodontal progression. You'll notice your tissues in between your teeth will start getting red, kind of bright red, and then we'll start losing your tissue attachment around your bones there. This picture here shows your bone level support around your teeth, like I mentioned earlier. So this black and white spongy area here that we see around your teeth, that's your bone support. Right where the crown portion of the tooth stops and the root portion begins, we like to see that bone level right along that area. So as you see down the progression here, we start losing bone support along with the deeper pockets that you'll see. So we get horizontal bone loss, then here we'll start seeing vertical bone loss. Down here we start seeing almost 50% of your bone has been lost and your tooth can become mobile. Excuse me. So that's what we'll be measuring. 2 sets of numbers. The first set of numbers will be these pockets of tissues. The second set of numbers will be where your gum tissue meets the tooth, whether you have inflammation or recession. Okay, any questions?